the last lecture of Learning Module 2. Keep in mind, as we progress through the book, these lectures may be getting a little bit longer. Compared to the 5 to 10 minute videos we had to start, these will be more or less 15 to 20 minutes because of the depth and dense material that will be covered in each lecture. In this last installment for Learning Module 2, we will be looking at emergency care in life-threatening situation. Unfortunately, because you will be working with individuals, some that are active, some that are not, you will undoubtedly be presented with an emergency life-threatening situation at some point in your career. It may not happen at the start, it may not happen in the middle, but at some point you'll be faced with some sort of life-threatening situation that you will have to act. Hopefully you will not have to use CPR and AED, but if that is the case, we will be properly trained in order to do so. In this last section, we're going to be looking at life-threatening situations. First and foremost, let's look at a heart attack. A heart attack is caused by the same heart condition as cardiac arrest. A heart attack occurs over time when portions of the heart muscle die due to coronary artery damage. These coronary arteries in your body deliver oxygenated blood to the heart. Damage to these arteries cause insufficient oxygenated blood flow to the portion of the heart muscle tissue affected by the damaged coronary arteries. Therefore, due to this damage, the heart tissue dies due to lack of oxygenated blood. When we look at the signs and symptoms of a heart attack, we know that these typically include chest pain, shoulder pain, jaw pain, the feeling of indigestion, nausea, sweating, shortness of breath, and dizziness. Typically, men have these signs more than women. Men typically feel like there is something very heavy on their chest. Women, on the other hand, have more subtle signs of a heart attack. They may not even know that they are having a heart attack. These signs and symptoms can include nausea, lightheadedness, fatigue, shortness of breath, and sweating. Most times they don't recognize that they are having a heart attack because they don't have the typical chest pain as an adult man would. When we have a person have a heart attack, we should have the person sit down and relax in a comfortable position. We need to make sure that he or she is breathing normally and ask whether they have a heart condition. And if they do have a heart condition, if they are taking any medication to make the symptoms subside. Some people will complain of angina. Angina occurs when a part of the heart does not get enough oxygenated blood. When this occurs, the athlete feels pain similar to someone who has experienced a heart attack, but most often not as severe. If they are taking medication, it is important to know that they have what they are taking. If applicable, they should take this medication when they come see you. If they do not have their medication, or if they are not on medication at all, you can use a regular dose adult aspirin. The aspirin can assist in alleviating the symptoms by preventing blood from clotting in the coronary arteries. Therefore, it promotes blood flow to the heart. Therefore, the heart tissue will not die. In this situation, even if they have medication or they don't, and they are complaining of the signs and symptoms previously discussed, we should call 911 immediately, and we need to be prepared to administer CPR and use an AED if the athlete or individual goes into cardiac arrest. Stroke is another life-threatening condition that we need to be aware of. When arterial blood flow to the brain is insufficient or blocked, or internal bleeding occurs, a stroke can occur, or a cerebrovascular accident. This is also referred to as a CVA. Signs and symptoms of a stroke include weakness, paralysis, which is an inability to move a body part, numbness or tingling on one side of the body, vision problems, slurred speech, sudden headache, dizziness, confusion, and chest pain. An athlete can go into having a stroke with no warning, and some stroke signs and symptoms can mimic other conditions, so we need to be careful in our treatment. In any situation that a person is displaying signs and symptoms of a stroke, we need to call 911 without delay. A somewhat more common life-threatening condition that we may see in an athletic participant are seizures. Seizures are caused by unexpected, abnormal electrical discharges from the brain and spinal cord. When an athlete is seizing, a change in behavior or abnormal, uncontrollable motor function results. Sometimes the athlete experiences an aura, which indicates a seizure is forthcoming. An aura is simply an abnormal feeling of the mind and body that may come directly before an athlete experiences a seizure. There are two main types of seizures that we will be looking at. In general, there are 7 types, but we're going to talk about the most severe and the mildest type of seizure. The most severe seizure is a tonic-clonic type of seizure. This is also called a grand mal seizure. It is easy to recognize because this is when a person has very large contractions of the body as they go into tonic-clonic muscle contractions. These are very significant and can be dangerous for the athlete and those around them. Although the athlete in this situation may have their eyes open, they will be unconscious and unaware of their surroundings. They will not be able to respond to any verbal or tactile commands. When you say, "Are you okay?" or ask them their name or call them by name, they will not be able to respond. The athlete's eyes may appear to roll back into the back of their head with very clenched teeth. He or she will also be breathing very rapidly. In any of these types of situations, when you see a tonic-clonic grand mal seizure, we need to let the seizure run its course. We do not want to hold the athlete. We do not want to restrain the athlete. However, we want to protect the athlete and bystanders from harm as best we can. We need to clear the area of objects such as tables and chairs and other potentially dangerous items that could fall onto the patient, and we also need to immediately designate someone to call 911. We need to make sure, again, that we allow the seizure to run its course. If possible, we need to loosen any clothing that the athlete may have on. We need to place something soft, such as a sweatshirt, a pillow if nearby, or another shirt underneath his or her head so they do not forcefully hit their head onto the ground and cause further damage with a cerebral concussion. And we need to stay with the athlete during the course of the seizure. At all times, even though you may hear them breathing rapidly, we need to monitor his or her breathing at all times. As stated before, we need to stay with the athlete at all times as the seizure runs its course. Even after the seizure is completed, we need to wait with the athlete until EMS arrives. After the seizure is over, we need to make sure we put them in the best position, and that is the modified Haynes position that we discussed before. The mildest type of seizure is a petit mal or an absence type of seizure. Absence seizures have little signs or subtle signs and symptoms. Children are more likely to have these types of seizures than adults. This occurs when a child appears to be staring at an object and daydreaming with a dazed look or glazed look over their face. In this situation, they are unable to respond during the time of the seizure. Usually, as a child gets older, the seizures will stop. As with tonic-clonic seizures, we need to allow the absent seizure to run its course. Usually, these types of seizures resolve in less than 20 minutes. Again, we need to stay with the athlete until the seizure is over. However, EMS is rarely called in these types of situations. Choking is something also that may occur. Choking occurs when an object goes into the trachea and blocks airflow when an athlete is conscious or unconscious. Most often, choking athletes are conscious. For example, an athlete can choke when they are talking, when they are eating, or they may choke on their mouth guard. In this type of situation, we need to encourage the athlete to continue coughing. By having the athlete cough, the object may dislodge from the airway and be expelled. However, when we start to hear a high-pitched wheeze or squealing sound from the athlete, We know that the object in the trachea is blocking the wind from going into the trachea. At this point, we must give the athlete abdominal thrusts. In this situation, before we give abdominal thrust, we need to ask if the athlete is choking. If they say yes, we need to make sure that we maintain position behind the athlete, support the athlete, and deliver 5 back blows between the shoulder blades to help eject the object, and then deliver 5 slow, controlled, strong thrusts to the abdomen. We need to deliver these thrusts in an upward direction in the abdomen. We need to then continue 5 back blows and then 5 abdominal thrusts until the object is expelled from the athlete or the athlete is unable to breathe and they go unconscious. In this situation, we then call 911 and we apply our CPR skills until EMS arrives. A very common thing that we see in athletics is shock. Shock is the body's reaction to loss or diminished blood flow, which results in an inability to supply oxygen to the brain and vital organs. If shock is not treated immediately, then the athlete can die. There are many various types of shock. We will be talking about a few of them. First, hemorrhagic shock causes a decreased quantity of blood in the circulatory system. This occurs when a vein or artery is severed and the athlete is bleeding externally or internally. This causes a decreased quantity of blood to the circulatory system, and because there is decreased blood to the circulatory system, there is not adequate blood and oxygen delivered throughout the body. Next, we have hypovolemic shock. Hypovolemic shock occurs with a loss of body fluids. If an athlete is not taking in adequate fluids to replenish the fluids he or she has lost in athletic competition or practice, hypovolemic shock may occur due to dehydration. Next is cardiogenic shock. Cardiogenic shock occurs during and after a heart attack due to the diminished quantity of blood flow through the body. Consequently, lack of oxygen is delivered to the body tissues and leads to shock. Psychogenic shock is brought on by witnessing or hearing about a drastic event. When an athlete experiences, they have emotions such as fear or grief, and these emotions can cause the athlete to go into shock. Neurogenic shock is a type of shock that typically occurs when an athlete experiences severe spinal cord trauma. Next, we have septic shock. Septic shock occurs when an athlete has a significant bacterial or fungal infection. Septic shock occurs because this type of bacteria, typically Streptococcus pneumonia, which causes ear infections, meningitis, and pneumonia, gets into the body, and the infection precipitates a series of events that result in a lack of blood flow, which causes, again, a lack of oxygen to the tissues. Lastly, we have anaphylactic shock. Anaphylactic shock also is a serious condition that can result in death. This shock is caused when an allergen enters the athlete's body. An allergen is a substance that causes sensitivity or an allergic reaction or response by the athlete. A mild reaction includes hives or a rash appearing on the skin. However, in severe cases, the blood vessels dilate, become permeable, and release blood and fluid into the body. When this occurs, the athlete is then, again, not allowed to filter throughout the body, and oxygen does not get to the body, and the person goes into shock. Most types of shock have similar signs and symptoms. We will look at these in the next slide. Before we look at these signs and symptoms, check out this video on how to use an epinephrine autoinjector or an EpiPen in order to decrease an anaphylactic shock. As stated, most types of shock have similar signs and symptoms. These include glassy-eyed stare, disorientation, agitation, increased respiration rate, dilated pupils, rapid, weak pulse, and you can tell that an athlete is going into shock with these similar signs and symptoms. A lot of them have cool, sunken-in eyes with this rapid, weak pulse. When we see these signs and symptoms, we need to treat for shock immediately. We need to treat for shock by keeping the athlete warm and calm, by putting a blanket or a jacket or any soft material over the person. If the individual has lost blood and fluid, they may feel thirsty. But in this situation, we do not want to give them anything to drink by mouth because they will most likely not be entirely coherent, and you don't want to choke the athlete by giving them something by mouth. If we suspect something more serious, such as cardiogenic shock, which is related to a heart attack, septic shock, or anaphylactic shock, we need to call 911 immediately. Next, we will look at asthma exacerbations. Asthma is a chronic condition that occurs when the respiratory tract becomes inflamed and the bronchi become constricted. Allergens and other substances that trigger asthma exacerbations could include pollen, pollution, smoke, aerosols, perfume, and other substances in the air. Also, exercise and various emotions can also cause asthma exacerbations. Physiologically, asthma can occur due to inflammation, bronchospasm, or both. As an allergen enters the body, such as pollution or dust or a medication, over a period of time an inflammatory response is triggered. The inflammation triggers through creation of mucus in the passages of the respiratory tract, which causes a decreased airflow in the respiratory tract. Common signs and symptoms that we see with asthma exacerbations include wheezing, shortness of breath, increased respiratory rate, coughing, chest tightness, headache, nausea, anxiety, nervousness, and the feeling of being unsettled. When we treat an individual for an asthma exacerbation or an asthma attack, we need to first ask them if he or she is asthmatic. If they say that they are, then ask them if they have their medication. If they have their medication, they should use their inhaler. These rescue inhalers are meter-dose inhalers that expel a specific dose of prescription medication. When we use these properly, they typically alleviate acute asthma exacerbation signs and symptoms. These are supposed to work very quickly to normalize the athlete's respiratory rate and quality. If it does not relieve the signs and symptoms after a short period of time, we need to call 911. If the exacerbation does not subside within a couple of minutes, then we need to also call EMS or 911. In addition, we need to make sure that we're monitoring the athlete to see if his or her lips, face, nails, or skin turn cyanotic. Cyanotic is a blue color. If this occurs, then we also need to call 911 because there's a lack of oxygen and increased carbon dioxide in the person's tissues. Next, we will look at diabetic emergencies. This sometimes is not a problem in athletics. However, we do see this from time to time. However, for those working in OT, PT, or in a hospital setting, we may see diabetic emergencies more often. Diabetes mellitus is a condition characterized by high blood glucose or sugar levels due to the pancreas being unable to properly produce the hormone insulin. It can also be caused by the body being unable to utilize the insulin that the pancreas has produced and secreted into the body. Overall, there are two types of diabetes. Type 1, which was formerly referred to as juvenile onset diabetes, includes the athlete's body not able to produce insulin. Therefore, because the athlete's body does not produce insulin, the athlete cannot break down sugar and carbohydrates. This type of diabetes typically is diagnosed in children and young adults. The other type of diabetes is type 2 diabetes. Type 2 diabetes can produce insulin, but the body is not able to produce sufficient amounts or the body's cells are unable to utilize the insulin properly. Most often, athletes who are affected by type 2 diabetes are those that are sedentary, overweight, and have improper dietary habits. In this situation, type 2 diabetes and type 2 or type 1 diabetes can be treated. Type 1 diabetic athletes must self-administer insulin and monitor his or her blood glucose daily. For type 2 diabetics, most times treatment includes monitoring their blood sugar levels and a change in diet and adequate exercise. These two things may be sufficient enough to control the athlete's blood sugar levels at a normal range. However, if this does not occur, then insulin may be prescribed by their physician. Other diabetic emergencies related to type 1 and type 2 diabetes include hypoglycemia. Hypoglycemia, or low blood sugar, occurs when the body breaks down sugar during activity, leaving the body without blood sugar. Consequently, the body's sugar levels will be very low. Another cause of hypoglycemia is high insulin and low sugar in the body. For example, you may be taking in an adequate amount of sugar. However, the insulin in the body is not able to break down the sugar. Signs and symptoms of hypoglycemia include dizziness, confusion, weakness, fatigue, and headache. And in severe cases, hypoglycemia can lead to insulin shock. The athlete in this situation may lose consciousness, have a seizure, or fall into a coma. The opposite of this is hyperglycemia. Hyperglycemia is excess sugar in the blood, and when insulin levels are too low or insulin is not being used properly. Signs and symptoms of hyperglycemia include glucose in the urine, as measured by ChemStrips, glucose in the blood, as measured by self-monitoring blood glucose equipment, and increased appetite, thirst, and urination. Hyperglycemia can lead to a life-threatening condition called diabetic coma, and this is also known as a diabetic ketoacidosis. Diabetic ketoacidosis occurs when the athlete's blood glucose levels remain high and the athlete's body is unable to effectively utilize the glucose for energy. Therefore, the body will use fat as a source of energy. These individuals will exhibit the same signs and symptoms of hyperglycemia. However, the big difference is that because there are increased ketones in the body, they will have a fruity smelling breath. You can review this table for the typical signs and symptoms of hypoglycemia, hyperglycemia, and diabetic ketoacidosis. Next, let's look at some heat illnesses. I don't have a lot about heat illnesses on the slides. You can refer to your textbook for more information. Let's start with heat syncope. When we look at these heat illnesses, including heat syncope, heat cramps, heat exhaustion, and heat stroke, these typically occur outdoors when the environmental temperatures and relative humidity are high. If the relative humidity is high, then we have less evaporation that occurs within the body. Consequently, the athlete's body will not sufficiently eliminate heat. Therefore, the body is not sweating as much because the environment around them is so dense with liquid that the liquid of the individual will not evaporate into that air. This causes the athlete to be susceptible to heat illness. Our first heat illness is heat syncope. This occurs when an athlete is exercising in a hot environment and becomes dizzy and lightheaded. Typically, fainting occurs. Fainting typically occurs due to the blood vessel vasodilation, blood pooling at the extremities, and dehydration. When the person faints and falls to the ground, the blood is then redistributed to the vital organs and the brain. After fainting, the patient typically returns to full consciousness within a short amount of time. Heat cramps are involuntary, painful muscle spasms that typically occur at the gastrocnemius abdominal muscles while exercising in hot, humid environments. Heat cramps are a result of dehydration and a lack of electrolytes in the body. These are typically painful to the person, and we need to stretch and apply ice or an ice massage on the painful tissues. Heat exhaustion is notably more serious than heat syncope or heat cramps. If an athlete does not continuously replace the fluids, then he most likely will succumb to heat exhaustion. Signs and symptoms typically include profuse sweating, pale skin, rapid weak pulse, increased respirations, lightheadedness, and dizziness. The core temperature of this athlete may be around 104 degrees, and they will have clammy, moist skin. We need to immediately remove this person from the hot environment and cool them down by removing all their sweaty clothes, putting fans on them, and applying ice packs or ice towels to the neck, armpits, and groin areas. We also need to rehydrate the athlete by drinking water or electrolyte drinks if the athlete is conscious. In this situation and in heat stroke, the individual should rest for the remainder of the day and we need to refer the athlete to a physician if they have more bouts of heat exhaustion. Lastly, heat stroke is a life-threatening condition and occurs when the athlete's body is unable to regulate the core temperature. The athlete in this situation is severely dehydrated, their pulse is rapid and strong, and respirations are increased. The athlete's core body temperature is above 104 degrees and the skin appears hot, red, and dry. The biggest difference between heat stroke and heat exhaustion is that the athlete appears disoriented and they do not respond to the questions or commands you have for them. They also may become unconscious. Similar to heat exhaustion, we need to get the athlete out of the hot environment, remove their sweaty clothes, place them in a cold immersion tub up to their neck, and monitor their core body temperature. And while we are doing this, we need to call 911. We do not want to give them any fluids by mouth, as typically in this situation they may fall unconscious at any time. Next, we will look at cold illnesses. When we have cold illnesses, this is when the body temperature drops slightly below the athlete's normal body temperature. Even when we have a slight decrease in body temperature, shivering occurs. This is the body's attempt to protect itself by shunting blood away from the extremities toward the trunk so it can keep the vital organs and the brain functioning properly. When the body temperature decreases further to about 95 degrees Fahrenheit, then the body becomes hypothermic. When we look at our cold illnesses, there are 3 that we will be discussing. Frostnip is the first one. Frostnip is the least severe and occurs when the athlete is in the cold for a period of time and his or her body temperature decreases. Typically affected areas include the fingers, toes, ears, cheeks, and nose. In this situation, ice crystals form within these tissues. The tissues feel very cold and begin to lose color and feeling. In this situation, we need to re-warm the tissues by putting them in a warm air or a warm object, or by putting them in the armpits. The athlete should not rub the area. Frostbite is more severe than frostnip. Frostbite affects the same areas as frostnip and can occur superficially or deep. Superficial frostbite occurs when ice crystals form in the tissues. The athlete's tissues in this situation appear waxy and without typical color due to lack of oxygen. They may also complain of numbness and loss of function in the area. With deep frostbite, the tissues are so numb that the affected areas are no longer painful. The tissues are extremely hard and they cannot be moved actively or passively. In addition, blisters may begin to form on the skin. At this time, we need to get the athlete out of the cold environment and rewarm the tissue immediately. We need to remove any wet, cold clothing, put on dry clothing, and cover the athlete with a warm blanket. We need to also place the frostbitten body part in warm but not hot water. As we are treating a person with frostbite, we need to call 911 and have them transported to the ER for immediate treatment. Lastly, hypothermia. Hypothermia is the most severe and it is a life-threatening illness that occurs with prolonged exposure to the cold environment. The body temperature decreases to 95 degrees Fahrenheit or lower. And in this situation, the body tries to conserve heat and oxygen in the blood by moving it to the brain and vital organs. The blood vessels also become constricted. The athlete may begin to have major nervous system and brain dysfunction, maybe become confused, disoriented, and lethargic. The body tissues also become hard and stiff, and intense shivering occurs until the body temperature falls to 86 degrees Fahrenheit when shivering stops. Our first order of business to treat this individual is to call 911. We need to lay the athlete down and attempt to rewarm him, her by removing cold, wet clothing and placing the person with many layers of warm blankets over the entire head and body. In addition, we need to continue monitoring the person until EMS arrives. Lastly, we have environmental emergencies. The most important life-threatening situation that we may come across is lightning if we are outdoors. We need to make sure that in any situation, we need to avoid exercising outdoors when a thunderstorm is approaching. We need to educate our athletes and make sure this is built into our emergency action plan. If lightning or a thunderstorm is approaching, we need to make sure that we get the athlete into a building. If a building is not nearby, the athlete should get into a car. If this is also not nearby and the athlete is outside without any shelter, he or she should squat down low in a position that makes their body minimal to the ground. In addition to know when the environment is safe to go back into play, we need to use the flash to bang method and the 30-30 method. The flash to bang method helps you determine approximately how far away the thunderstorm is from our location. We can use this by when we see lightning, we need to begin counting 1 Mississippi, 2 Mississippi, and so forth until we hear the clap of thunder. Then we need to divide the number of seconds by 5. The result is how many miles the lightning is away from your location. In this situation, this is a great indicator if we do not have a commercial lightning detector. We can also use the 30-30 method. This method is if you hear thunder after 30 seconds of seeing a lightning flash, lightning is only 6 miles away and a strike is imminent and we need to leave the location immediately.